Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is radius bone. So today we will discuss about the bone that is radius. So first point, that it is a long bone and it is situated at the lateral side of our forearm. So it is situated at the lateral side of our forearm. Okay, and it is two in number. One is in left hand and one is in right hand. Then, so first of all, that we know that as it is a long bone, so it must have three part. One is upper end, one is body or shaft, one is lower end. So first, morphological features. First of all, upper end. What are the consisting part of the upper end? We will discuss now. In case of upper end, it is smaller in size and directed upward. And it is consisted of, what are the consisting part? Consists of number one, that is head, number two, that is neck, number three, that is radial tuberosity. So the head is concave and it articulates with the capitulum of the humerus. To form the humeroradial joint. And the neck, it is constricted part below the head. And the radial tuberosity, that is, it is a rough impression directed anteromedially. So first of all, in the upper end, it is smaller. It is smaller in size and directed upwards, and it is consisted of three parts. One is head, neck, and radial tuberosity. Head is concave and which articulates with the capitulum of the humerus to form the humeroradial joint or radiohumeral joint. And in case of neck, it is constricted part which is present below the head, and radial tuberosity. So what is the neck? The neck is the constricted part which is present below the head, and the radial tuberosity, that is the rough impression that is directed towards the anteromedial part. Okay, and now we will discuss about the lower end. In case of lower end, it is wider and must be directed downwards. So, and it has five surfaces. Number one, that is anterior surface. Number two, posterior surface. Number three, lateral surface. Number four, medial surface. Number five, inferior surface or carpal articular surface. So lower end is much wider and it must be directed downwards, and it has five surfaces. One is anterior, number two is posterior, number three lateral, number four medial, and number five, that is inferior or carpal articular surface. So now let's discuss one by one. Anterior surface. Anterior surface is the continuation of the anterior surface of the body or shaft of the radius. So what is this? It is the continuation of anterior surface of the body or shaft of the radius. And the posterior surface, this is the continuation of posterior surface of the lower end, and there is a tubercle which is known as dorsal or listed tubercle. And the lateral surface, from the surface there is a bony projection present which is known as styloid process. Styloid process. And this styloid process we can also feel the radial pulsation. So it is has, here we can feel the radial pulsation. And it has some clinical importances also. The lateral surface. Clinical importance is Colles fracture. We have already discussed a dedicated video about the Colles fracture. You can see that. So Colles fracture, if anyone falls on outstretched hand, then the fracture happens, which is known as Colles fracture. So what we have discussed till now, we have discussed about the anterior surface, that is the continuation of the anterior surface of the body of body or shaft of the radius. Then we have discussed about the posterior surface, which is the continuation of posterior surface of the lower end, and in this position a tubercle is also present which is known as dorsal or listed tubercle. And the lateral surface we have discussed that from the surface there is a bony projection present which is known as styloid process, where we can feel the radial pulsation, and there is also a clinical importance present, that is one is Colles fracture. So Colles fracture, it when it happens when someone falls on an outstretched hand. Then the medial surface. In case of medial surface, there is a notch present, and this notch is present for the attachment of the lower end of the ulna. And it forms the inferior radioulnar joint. Radioulnar joint. So what happens in the medial surface? Here a notch is present in the lower end of the ulna, and it forms the attachment. It forms the attachment site for the lower end of the ulna and forms the inferior radioulnar joint. Now, the fifth surface, that is inferior surface or carpal articular surface. In case of inferior surface, this surface is divided by one line into two parts. One is lateral quadrangular part, and number two is medial triangular part. Now the medial triangular part articulates with the lunate, which is a carpal bone, and the lateral quadrangular part articulates with the scaphoid bone, which is also a carpal bone. So it forms the radiocarpal joint. This is scaphoid, this is lunate. This is the lateral side first, this is the medial side, and here is the styloid process present. So these are all the surfaces that present in the lower end. Now we will discuss about the body or shaft part. Okay. And it is the part between two ends. It is the part between two ends, that is upper end and lower end. And it has three borders and three surfaces. So what are the borders? First of all, three borders. Number one is anterior border. Or volar border. Number two is posterior border. Number three is medial or interosseous border. So first of all, the anterior border. In case of anterior border, it starts from the above and upper two-thirds of it is oblique, but the lower part is ill-defined. So in case of anterior border, the upper two-thirds part, it is oblique, and lower one-third is ill-defined. Then comes the posterior border. In case of posterior border, it is almost rounded but non-prominent. It is almost rounded but not prominent. Then the medial or interosseous border. It is very sharp and prominent. It is very sharp and prominent. Now a question comes in our mind, why the medial border is also known as interosseous border. So it is a question that comes in our mind. Now we'll discuss that answer. So if you take that, this is a radius bone, suppose, and this is the ulna bone, radius ulna. Here a gap present. This is known as interosseous membrane or medial radio ulnar joint. As because the border articulates with the interosseous membrane and which forms the medial radial ulnar joint, that's why this is known as interosseous border or medial border. Okay. And in this border, the border is very sharp border. So one crest is present. Crest present. Now there are three surfaces also present. Three surfaces. One is anterior surface. Number two is posterior surface. And number three is lateral surface. In case of anterior surface, it belongs in between anterior and medial border. So anterior surface present between anterior and medial border. In this surface, the nutrient foramen present. where the nutrient artery passes, and the posterior surface it belongs in between the posterior and middle border, present between posterior and medial border. Then comes the lateral surface. And lateral surface present between the anterior and posterior border. And this surface is rough and rounded. So here the border, three borders are anterior border, posterior border, medial border, and surfaces are anterior surface, posterior surface, and lateral surfaces. So these are the borders and surfaces. Now if you do the schematic representation or a short summary. So what we have seen, the bone we have discussed today is radius. So this is the upper end, this is the body or shaft, this is the lower end. So in case of upper end there are three parts. Then one is head, which is small globular head, and it articulates with the upper end of the ulna and form the superior radial ulnar joint. Here one joint is present, that is superior radio ulnar joint. Then comes the neck and then radial tuberosity. Then body or shaft, three border, three surfaces: anterior border, posterior border, medial border, anterior surface, posterior surface, lateral surface. Then we have discussed about the lower end. Lower end has three surfaces. One is anterior, then posterior, then lateral, then medial, and in the last, that is inferior. So these are the all surfaces and the structures that is present in the radius bone. So today we have completed the morphological part of the radius bone, and in the next video we will try to cover the attachment of the radius. So what we have discussed today, what is our topic of discussion today? So today we have discussed about the radius morphology. So what is radius? Radius is a long bone which is situated at the lateral side of the forearm. Okay, and this is 2 in number, and it is, as it is a long bone, so these are present. These have three parts: on is upper end, on is lower end, and one is body or shaft. Then we have discussed about the morphological features of the radius. So what are the morphological features? In case of upper end, it is smaller in size and directed upwards, and it consists of head, neck, and radial tuberosity. The head is a concave and which articulates with the capitulum of the humerus to form a joint, that is radiohumeral joint. Then the neck, it is constricted part below the head, and the radial tuberosity, that is the rough impression directed anteromedially. Then we have discussed about the lower end. Lower end has 5 surfaces which is wider and must be directed downwards: anterior surface, posterior surface, lateral surface, medial surface, and the inferior surface or carpal articular surface. The anterior surface is the continuation of the anterior surface of the body or the shaft of the radius. The posterior surface, that is the continuation of the posterior surface of the lower end, and there is a tubercle also known as the dorsal or distal tubercle. Then the lateral surface, that is from the surface there is a bony projection is also present, which is known as the styloid process. And the styloid process on which you can feel the radial pulsation also, and it has a clinical importance, that is the Colles fracture. We have a dedicated video on this topic, and if anyone falls on the outstretched hand, this type of injury can happen. Then the medial surface, there is a notch for the attachment of the lower end of the ulna, which forms the inferior radioulnar joint. Now the inferior surface, there is a surface that is divided by one line into two parts. One is lateral quadrangular part, one is medial triangular part. The lateral quadrangular part articulates with the scaphoid and medial triangular part articulates with the lunate, and which forms together the radiocarpal joint. Then the body of shaft. Body of shaft, it is the part in between two ends, and it has three border and three surface. On the anterior border, posterior border, medial border, and three surfaces: anterior surface, posterior surface, lateral surface. So this is our today's short topic. So if you have any query or any doubt, you can comment down in the comment section. And thank you so much for watching the entire video. Like, share, and subscribe to my channel for supporting me and my channel. And please comment down if you have any doubt. Thank you so much.